Hi, my name is Dr. Joseph Yazdi. I'm a board-certified neurosurgeon with over 20 years of experience. My goal with this video is to provide a complete reference guide for you about your surgical procedure. I will explain to you why and how your surgery is performed, review the risks and benefits of the surgery, and other treatment options to consider. We will also discuss your post-operative care. I hope that this video will be a recreation of your office visit and a good reference guide for you, your family, and your friends. The typical reason to come and see me is for neck pain and usually also some combination of arm pain, numbness, or weakness. By the time we're talking about surgery, that means you've already had conservative treatments such as therapy, chiropractic treatments, injections, medications, and none of them really worked. So now you're looking into the next step, which is surgery. The most critical part of surgery decision making is to see if your symptoms correlate with the MRI or CT scan findings. If they do, then your surgery should have a very high success rate and it will be a good option for you. Our goal for surgery is to resolve all your symptoms and get you back to work with full function. We need to first look at an anatomy on this MRI. So the way we count the bones, we start with C2, it's the one with the big peg on top, C3, C4, C5, C6, and C7. And the discs that are between them are named by the bones above and below. So this is the C2-3 disc, C3-4 disc, C4-5 disc, C5-6 disc, and C6-7 disc. Behind them in the middle is the spinal cord. That's the gray structure running straight down. As you can see right here at C4-5, not only is there a disc pushing out, but really the big problem here is that the bones are not lined up on top of each other. This bone is way pushed back, causing pressure on the spinal cord. In this case, because of that instability, a fusion is a better procedure than a disc replacement. So even though the disc replacement is the most common procedure in the cervical disc, we will want to do a fusion in this case because we want to realign it and hold it in that position. Now, this is the axial view. What that means is that if I take a cut right across this disc and look at it from the top, I'm going to see this image here. The spinal cord is in the middle, the discs are in the front, and this dark area right here is the disc pushing back towards the spinal cord. When we are done with our discectomy, this entire part's going to be gone. So how do we do that? We make an incision in front of the spine, right in the crease in front of your neck, work our way down, push the breathing and the swallowing tube to the side, and come right in front of the spinal cord, in front of the spine right here. We will take out the entire disc, especially including the back part that's pushing on the spinal cord. And then by distracting these two bones away from each other, we realign them. We have special devices that measure the space where the disc used to be, so we put in a perfectly well-fitting graft in that space. And then we want to secure it in place, like as if it is in a cast, so it heals best. And that's done by putting a plate in the front with screws that screw into the bones above and below. This model shows a two-level disc fusion. As you can see in the middle, where the disc used to be, now we have these implants that are tan color. And then we have the plate with the screws, and you can see how the screws screw into the bones above and below the implants. Over the next few months, there will be bone growth across the implant. So what are the risks of cervical surgery? There's risk of bleeding and infection, just like any other surgery. Also, we have to push the breathing and swallowing tubes out of the way. So there's a chance of sore throat, difficulty swallowing, and a hoarse voice. The rest of the risks are related to working on and near the nerves in your spine. They include things such as weakness or paralysis, numbness, bowel and bladder dysfunction, spinal fluid leak, and that surgery may not resolve all your symptoms. The risk of all these surgeries is very low, and even if they do occur, the main common ones are difficulty with swallowing and hoarseness, and they resolve after about 4 to 6 weeks. In case of a cervical discectomy and fusion, there are additional risks that you should be aware of. Bone healing is what we're looking for. The people who are going to have the lowest chance of bone healing are smokers, and that includes using nicotine patch or anything that has nicotine in it, because it's the nicotine itself that prevents bone healing. Anybody who's got diabetes or other similar issues with that, and people with kidney disease because they have bad bone. You will typically be discharged home within a few hours from surgery. As for postoperative instructions, I would like to keep the dressing on and dry for the next 2 days. Then you can remove it and take a full body shower. But I would like you to avoid taking a bath or soaking it in a pool. I want you to keep lifting less than 10 pounds. You may walk or go up and down the stairs as long as you're comfortable. I will see you back in the office at 2, 6, and 12 weeks from surgery, and we will get x-rays periodically to make sure that everything is not only in good position, but that the healing is coming along as expected. You may get some physical therapy or chiropractic treatments after surgery. It will depend on a number of factors that we will discuss. Most patients typically go back to light duty work at 6 weeks and heavier work at about 3 months.